Hello, and thank you for tuning in to A Common Narrative, a campaign pitch for Lyme disease in Massachusetts. Lyme disease has been dubbed a global endemic. The disease starts with a fever or headaches and often relies heavily on the identification of a bull's-eye-shaped rash, as pictured, from a tick bite in order to receive a diagnosis. Unfortunately, the rash only appears in about 30% of Lyme cases, and many victims are left untreated, leaving the bacterial disease to spread into the heart, joints, and nervous system. It is the most common vector-borne illness in the United States, and confirmed cases have been reported in every city and town in Massachusetts. Yet many patients are left seeking treatment outside the state of Massachusetts because doctors remain untrained in the complexities of Lyme disease. We want to design a campaign that will support a new requirement for physicians in the state of Massachusetts. As part of the licensing process, physicians will be required to have basic training in Lyme disease. The campaign's target audience will focus on board members who will vote on this kind of requirement. Those boards include the Massachusetts Board of Registration, the Bureau of Health Professional Licensure, and the Accreditation Council for Graduate Medical Education. In order to affect their voting behavior, it will be most effective to design a campaign using the theory of planned behavior. In essence, this theory says that someone's behavioral intention is closely aligned with their actual behavior. So if a person's intention is to vote in support of the Lyme education program, then they are more likely to actually vote in support of such a program. In order to break it down just a little bit further, a person's behavioral intention is influenced by their attitude, subjective social norms, and their perceived behavioral control. A person's attitude is what an individual believes about a behavior. In other words, do the benefits outweigh the consequences in the eyes of the individual? Subjective social norms are the influence of the people in the individual's social environment. In this case, we would be looking at professional partnerships between the boards and the groups they work with. For example, Borum works closely with the Massachusetts Medical Society. And if the Massachusetts Medical Society did not see Lyme disease as a serious issue in Massachusetts, then members of Borum might vote against the Lyme education requirement because they would fear that they would lose their professional reputation with an important partnership for their career. Perceived behavioral control comes down to the resources, opportunities, and confidence an individual has to perform a certain behavior. In this case, does the individual have the confidence to raise their hand in support if others in the room do not? An effective way to influence the components that make up behavioral intention is through narrative communication. Stories and narratives engage the audience in a way that connects to their emotions. Studies have shown that after receiving narrative communication versus a more informationally based video, people were more likely to recall information, speak to friends and family about the information they received, and were less likely to counter argue with the information. All these things affect a person's attitude about the narrative's topic. When the audience perceives the narrator as similar to them, it has been proven to shape the audience's subjective social norms. Finally, engaging with peers after narrative communication and having small group discussions further shapes the audience's subjective social norms. Our communications campaign will affect behavioral intent with narrative communication. The campaign will include a website that features a blog where people can share their personal struggle with Lyme. This is the website. And here is an example of one of the blog posts we would have. It will have pages of videos with TED Talks, interviews, and other video types featuring Lyme victims, doctors, psychologists, and naturopaths, all of whom share their Lyme story. We will ensure the speakers are often well-educated medical professionals so that our target audience identifies with them. These stories will be shared on social media. The campaign will also involve a weekly newsletter. This will balance personal narrative, news, and statistical information. On a bi-weekly basis, board meetings will feature a live spokesperson who will share their own story and why they believe change around Lyme disease is so important. The presentations won't last more than 10 to 20 minutes, and the board members will get into small groups in order to discuss the presentation, Lyme disease, and the new Lyme education program. This part of the campaign will target subjective social norms. Thank you for listening, and here are my references.